Welcome to the Hit Like a Girl podcast. My name is Joy Rios, and on our show we talk about the complexity of healthcare and health IT. We talk a lot about how healthcare is like a 30,000 piece puzzle, and each one of us holds a piece of it, and we try to learn from one another and share our expertise. So on today's show, we have a very special guest, and I'd like to give you a moment to introduce yourself.
Thank you. My name is Bolbjerg. I'm the CEO and founder of Qure4U, a digital health company. I'm a physician from Denmark, that's the accent. Really been focused in the last 20 years on how do we use technology to improve the patient and provider interaction when they're not together. So really on how do we empower the patients when they're at home.
Well, I'm sure that that's come into play a lot within the last couple of years. Can you, so how old is your company, and how has it even changed, I guess, through the pandemic through that lens?
Well, I mean, our first company was in Denmark. In 2001, we created the first patient portal in the world.
Okay, wow.
So I've been at it a long time.
I'm sure you've seen it change quite a bit. What did the first patient portal in the world look like?
Yeah, well, and that name wasn't there back then, right?
Sure.
But it was really like, it was communication, it was scheduling, prescription refill, a lot of like sending data to patients back and forth. And it also turned into be a little bit a personal health record for patients in Denmark. And we had 30% of the population using our platform. So really a collaboration tool.
Wow.
But Denmark is a tiny little country. I mean, I love it. But,
what's the population there?
5.5 million.
Okay. Smaller than Los Angeles.
Yeah.
Okay.
So we came over here.
Okay.
And started up over here in 15. And now we're across the US, and we have 20,000 something users, not patients, providers using our tool.
Gotcha.
And it really over here started more with like the optimization of workflows, the digital check-in, stuff like that was kind of initially, and we've done telehealth and remote page monitoring for 10 years.
Oh, wow.
But people were like, oh yeah, not really. And then COVID hit, and then all of a sudden. And I think the biggest change with COVID was that the fear of this from the providers of like using tools like that with patients actually went away.
Well, they had to do it. There became not a choice, right? Right. You have to do something.
Yeah. And so that kind of like changed the whole dynamic, and people were like now seeing, well, there's opportunities instead of like, oh, that's new, I don't want to do this.
Right.
So that's why we're seeing this acceleration now, in my opinion, of all the digital health tools out there.
Well, so then what have the iterations been, or at least maybe even in the last couple years, what have been the biggest changes in Qure4U?
I think looking at the entire patient journey and not just focusing on getting pre-registration forms.
Okay.
So people are now more looking at this as a care strategy, like really like how do I, as an organization, look at the entire care journey for my patients, and how to make sure that that is a personalized, easy to use experience for patients, but that is also branded as an organization. So people really see this, our organizations see this as a really strategic tool. And so I think that's the biggest change from like before it was like, oh, I have a need here, I have a need here. Now they have a strategy, right? They're really looking at a platform play.
One thing I've been thinking about is the patient journey. Like, how long of the patient journey are you capturing within the patient portal? I mean, it's visit by visit, but also in between?
Yeah, so I mean, we don't really do a patient portal anymore. All that's gone.
Gotcha.
You don't log in. That's not what people do anymore. It's you capture the patient where they are, and sometimes it's a text message, sometimes it's an app. It really depends on the patient.
Okay.
So multiple touch points, but it is the entire journey. That could be very long. If it's a chronic disease, it's a year-long journey. It goes on, right? But it can also be a procedural care that is just a month or so.
Okay.
So the tools are out there now today that you can really create a personalized experience around that patient and where they are in their journey.
And really trying to engage with them, to your point, around it's text messaging, it's emails, and it sounds like it must be engagement in the sense of questions and answer. Like, how do you get them to, are they interacting with you, or is it more of a push and then they're just like listening? Oh no, it's absolutely interactive. It's bi-directional, but I mean the thing is that it comes from their provider, right? So it's not us, it's the provider, and so and once things are coming from a provider,
and it's really personalized from their provider. Patients do it. I mean,
Sure.
they love it.
Well, yeah. So, for example, I mean, with my doctor, there is well, of my age, right? So things that show up in my portal or that I get notified about have to do with me as a woman of a certain age and things that I might be thinking about. I might be thinking about, or you know, I might want to explore. Is that like resources that you might offer up to the providers to share with their patients?
It really depends on the individual provider organization and what their focus is.
Okay.
And some are more in that direction. Some have risk-based contract, value-based care, and then they're much more in the kind of like, how do we optimize that care, like as a package, more or less.
Yeah.
And the other ones that are more like fee-for-service are thinking more, alrighty, well, I need to make sure that for the next visit, that patient is now better than last time, right? So but using technology to then empower the patient to know what they need to do at home.
Yeah, I'm really interested, if you don't mind my asking, the difference between the Danish market and here, and like, are the words fee for service and value-based care even in the language over there? Is that something that you guys talk about in those terms?
Well, it is. It is a one-payer system, right? But it is still fee-for-service.
Okay.
And so it's actually fairly similar to over here. I mean, the complexity of like having multi-payer is not there, but it's still fee-for-service. There's some value-based care, not too much. There's less reporting, although it's coming more and more. So everybody wants data. And so
that data is the king, right?
Yeah. But it's interesting because Denmark was really the first country to do anything in this area, but they fell behind.
Okay.
And so now it's actually in the US where we see things are moving much faster than the rest of the world.
Interesting.
Yeah.
Wow. Well, you've been in healthcare for a long time, obviously, right? If you were the founder of Qure4U, can you tell me a little bit more about your personal journey? Like, is this something that you thought you were going to do when you were?
Absolutely not.
Okay, yeah. What did 10-year-old you think you were going to do?
So both my parents are physicians, it was more like that path, both surgeons, and so I was like on the road to be a surgeon as well, doing a PhD. Then they put me in the basement of the hospital in a single room and said I was going to do labs. That's not me.
Okay.
And so at the same time, my mom was she did the first website in Denmark with online scheduling and secure messaging.
Really? Your mom was like a coder or a programmer?
No, but she had problems in figuring it out, right? She had a vision. And so I was like, well, if she has that need, maybe a lot of others have. And then I was like, well, let's build a system for that. So it was.
How old were you in that, if you don't mind my asking? Like, at what age were you just like, I am going to take that on, I'm going to learn that as a skill?
Well, I didn't we didn't do the coding ourselves, right? But I called my husband and said, like, why don't we quit our jobs and do this? And we had 2 little kids and just bought a house. It was crazy.
Yeah.
So we were like late 20s, and so. Anyway, it went well.
That's wonderful.
It's been a lot of fun.
Yeah, but I mean, that's a conversation that's been showing up lately a lot, of like, how do you find the courage to do something like that, where it's like, that's a big leap of like, okay, I have 2 kids and a husband and we're both going to quit our jobs and just take on this big thing.
Yeah. Well, I think it's a personality thing.
Fair.
I take a lot of risk in my personal life. Not with my family. We been together forever, and I've worked with my husband now for more than 20 years.
Oh my goodness.
So, for this, yes. I mean, it's not really.
It's kind of a way of life in a way. You're just like.
Yeah.
I think that there's something to be said for like a healthy amount of being scared, right? Of just like not knowing what you're doing and then forcing yourself to figure it out.
Yeah. Yeah, and I think, I mean, we were young. I mean, it was just like, this is fun, let's just try it.
Yeah.
So we didn't know what we were doing at all. And I think sometimes you just have to jump into it. If you have a vision and you have a passion, That's what drives a new company. It's not all the other things. You'll push through that. You'll find the way to push through, but you have to have the passion, absolutely,
100%.
and the energy. A lot of work.
Well, so if it started out as a family business, how big are you guys now? How does it?
I think we're around 70 people now. Had a Series B round last year, growing a lot. So yeah, it's fun.
That's really great. Well, I like to ask, what advice would you give to your younger self? Maybe pick an age, maybe in your early 20s. Like, what do you think she would have needed to hear in order to kind of maybe skip some of the challenges that you faced?
I think trusting yourself more. And I think maybe it's also a little bit a woman thing.
Yeah.
Like kind of stepping back a little bit too much. And I think at some point, actually more over here, I said, now I'm going to take the leadership on and I'm going to follow my gut, and I know better than anybody else what we need to do as a company and what works, and I think you really need to do that. I could have done that early on.
Yeah. Well, and also being the leader of your organization, being able to trust yourself, you get to also be the decision maker, right? So if other people are not necessarily seeing the same things that you're seeing, you might not have to fight for it, right? Like.
Yeah. Well, and the thing is that kind of like when you take on that leadership hat and you do it, it actually everybody's following along. They're like, they like it. I'm like, oh, right.
Yeah.
So it makes things easier.
Yeah.
I think maybe sometimes we are very flat organization, very collaborative, but there needs to be some leadership. And so, but I think also from a partnership and using consultants and all that stuff, like, I mean, at the end of the day, we in our company knows best because we work really closely with our customers, and listening to our customers is where we need to go. And I think early on we also had all kind of advice about we had to do this and we had to go out here. But at the end of the day, it's your passion, your customers, you know best what you need to do.
Absolutely. Lately I've been sort of thinking about long term of like, okay, where do I want to land? Where do I want to be in my career path? And understanding that there's not a map. There's not someone that's going to hand you a map and say, this is the route that you need to take. And being able to have trust in myself and the courage to just keep going, right?
Yeah.
And like listen to it. It will show itself. Yeah. And I'm sure that listening to your customers and listening to the market need is similar for you.
Yeah. Plus what we do is so cutting edge that nobody's done it before, so it doesn't help us to go out in the market.
Good point. Yeah. So what do you think is the most cutting edge thing that you all do?
We do it as a, like we look at the journey. We have a platform play, all right, and we really focus on helping the providers be best at their business, and we're very good at then figuring out how we have a consumer angle on that then supports the provider's business. I think having the kind of like understanding that and not, I think a lot of businesses out there are either too much consumer or too much providers and not understanding how you can put this together as a tool, and we've been really good at doing that so far.
Well then, so tell me about that. So how has the patient and provider encounters or face-to-face encounters sort of changed through working with you?
Yeah, no, it's great. It's a great question. So there's a lot of things you can outsource to patients, right? There are a lot of reporting that needs to happen. There are a lot of things, tick the box, that needs to happen for like during a visit. All of that can be pre-filled by a patient, so that when the doctor and the patient is together, they can focus on what is really the issue or the problem, the challenge that patient has today. That's one aspect. The other aspect is like all the home monitoring devices, remote monitoring, the capturing of data at home, gives the provider a whole new view of what is a patient, right? Because all of a sudden, I don't need to spend my time, and it sounds negatively, but it's like interviewing the patient to try to figure out what's going on. I can look at trends, and all of a sudden I can say, I see these trends of what you've been reporting at home, and now we can have a conversation on that. And that is also educational for the patient, because the patient now gets a better understanding of like, oh, yeah, well, I actually have more pain in the morning, or my blood pressure is going up and down, or when I have these things, and we can start to understand more what's going on with the patient. And I think that's a big differentiator that we're seeing, this shift we're seeing in healthcare now is being more about the patient data reported from home.
Yep.
Which it should be. We are home more than we are in the office, right?
Well, what is some of the patient remote monitoring that they're using? Because I think that a while ago, and we're talking years, it used to be like, well, what are you going to do with Fitbit data? Like, what does your doctor really need to know about how many steps you take?
I'm not a big believer in that stuff.
Yeah, and that's not really what you're talking about.
No.
So what kind of monitoring are patients doing that they're, like, what type of information are they sharing?
There's different sites. They're for the chronic condition, the blood pressure devices, or the home monitoring devices, and that's really, now we've done this for 10 years, finally at a point where those devices are solid and good and easy to use, and so that data flow can be stable to the physician. We capture patient-reported data like pain. It can be all kind of like mood, mobility. So it's really like there's no limit. What we do is we typically walk into working with a healthcare organization, like saying, what do you really need to know about that patient?
Right.
And so it doesn't need to be a device. You can ask questions to a patient, and you can map that out. It can be screening questionnaires. We do a lot of that as well for patient-reported outcome measuring. And so it depends on the organization. And it's still early days. I mean, we're really trying to figure out more and more smaller pieces, like what do we get, and focusing on not asking too much. I mean, sometimes the organization is like, I want to know it all. But it's too much, right? You're overwhelming the physician, and you're tiring out the patient. They don't want to report all that. So.
I understand. I like the idea of being really specific about, okay, what is it that you care about, and let's get really laser in on those things.
Yeah.
And then I'm sure that the patients also feel more taken care of, and that they're having richer conversations that are more relevant to them as individuals versus just maybe having the same conversation, or like feeling like they have to catch up between, from in between visits, like depending on how often they see a provider.
I think, I have a good friend of mine that is also one of our customers. He's always talking about the 6 minutes you have as a physician with your patient a week, and so I'm like, okay, how can I give you 1 minute back? I mean, 1 minute more. Take away some, that could be a conversation. That's a lot of time.
That is a lot of time.
And helping the patient, giving that a little bit more interaction, which I think will help with burnout as well from the physician, because that's why we become doctors. It's not to sit and report. It's to help people. So we got to find a way. How do we get back to that?
Yeah. Well, I don't know that anybody wants to be just like in their computer all day. It's that one-on-one interaction of really trying to learn about an individual and their problem, and try to support them and help them through it. Yeah.
Another thing that is happening as well is, and I think we'll see in healthcare now, where we are one of the only industries that have not really found out how to have a remote workforce, right? And we need to. Everybody else after COVID we have hybrid. You can work from home some days and you can be in, but healthcare is still like, no, we got to be together with the patient. But really, you do not. And so I think we're going to see a lot there, where you can have maybe you cut your front desk staff into half, and 2/3 of those work from home, and they can prep the patients, they can do all of that. And so you can have MAs that do data reconciliation and review the data at home, and some that measure blood pressure in the office, right? So there are ways to use technology that is brand new that I think we have to look at and see how we can kind of reinvent how we work, like really the processes in our
I like that. I like that. And I haven't heard that idea of being able to allow healthcare workers some flexibility in where they're working, because we do need to address burnout, and there has to be another answer. Like it can't just be one size fits all.
And so if we can sit at home one day, and physicians sit at home with a telehealth, right? Just one day, I can be at home, right? And I can be dressed in whatever from here down.
Business up top, casual at the bottom.
But I mean, it's nice to have a day during the week where you work from home.
100, yeah, 100%, 100%. I work from home and I'm a big proponent of it.
Yeah.
Well, if people want to work with you or find you, where would you recommend that they look? How could they get in touch?
Go to our website, Qure4U.com. It's a little complicated. It's a Qure, the number 4, the letter U.com.
Okay. And are you on socials? Can they find you on the social media as well?
Yeah, on social as well.
Okay.
Instagram, Facebook, and all.
Okay, and LinkedIn if they wanted to connect with you in personally.
Well. Yes.
Okay, wonderful. Well, thank you for joining me today. It's been a real pleasure. And thanks for watching Hit Like a Girl podcast. And you can follow us on Hit Like a Girl Pod on any of the social media or go to our website, just add .com to the end. Thank you. I'm Joy Rios.